previously, right? We did not see any. This is our first lab, right? With the
Yeah,
parts?
the first.
Okay. So where should we start? What is this?
Copper impression.
Coping.
The replica.
This one, the implant
Implant
replica.
So this is
That's
the
an
implant
implant
replica.
Yeah.
And there's this one and this one.
That's the long is for the open.
This
That's
is
for the open, this is for the close.
Yes. So the close, basically, just imagine this in any system. It's gonna look simpler and like a crown prep. It's smaller. It's gonna binge in. Always in any system again, the open tray that will have the grooves to get stuck. Okay? So this is gonna stay embedded inside the impression. So that why it has a good retention of a groove. This one is gonna stay in the patient mouth. So it's the impression has to slip out of it.
Which cases are we using open tray and closed tray?
Usually,
Open tray.
for accuracy, you use open tray, but most of the time for anteriors.
Anterior?
Okay, posterior it's hard to use open tray. Okay, or if you have, for example, multi-units, you use closed tray again for accuracy. Okay, so if it's
Multi-unit
simple,
closed tray.
open tray.
Open tray.
Okay, so anything with accuracy you need open tray. Okay, anything simple you use a closed tray. Make sense? And usually closed tray for the top, for the back, because it's simpler. So when you get me for a grading, these should be attached and secured. Okay, secured like this and clicked inside the impression. And the same thing here. It has to be attached to the closed tray one, the open tray one, okay? And that's it. Then, what are these?
There's a healing
Abutment.
Okay, what are the difference between them? What do you think?
The diameter and the height?
diameter and the height.
Okay, let's start with one.
That's the zebra.
Zebra.
Yeah.
What's this one?
That's I don't know. That's for
It's a healing.
It's like
Yeah, for the
but I
posterior.
think it's like
posterior.
Yes.
Is round.
And what is this?
For anterior.
For anterior, yes.
Because its
Because
cross
it's-
section
yeah,
is triangle.
triangle and
So the
then
triangle cross section is
for the
more
anterior.
aesthetic for anteriors. These are universal. They're the same. Okay. The difference between the same. Both they're gonna have different heights and different width. Okay. This is the difference that every stripe is a millimeter,
Yeah.
and this is you need to measure it. You know. So they're both exactly the same. Okay. Okay. What are these?
There's
Okay, this is the
looks like is the
Can I see it? Sorry, doctor.
Transfer another?
no.
is it a button?
Impression popping.
This is impression coping, this is open tray, and this is implant replica. These are miscellaneous things. I don't know what are these. But this is, for example, I think for the temporary healing abutment. So see how it has grooves? So basically, you put it in the patient mouth, you prep it a little bit with so it doesn't interfere without removing retentive groove, and you put over it the alginate, the acrylic or the integrity. So the integrity will lock to it. Okay?
So that's like a.
So that's gonna be not prefab. It's a temporary crown,
Okay.
but that's gonna be screw retained.
Okay.
Okay? We used to do it in the course, but they're not doing it.
How about this one in the mirror? Is it the same
Yes.
thing?
This is
Same
the
thing?
same thing.
The
Okay.
plastic one.
But this is more aesthetic
Stamp
because for
design.
interiors.
It's a stamp design
And
for
these,
the
if you
interior.
see, like you can prep the margins a little
Yeah.
bit. The only thing is important that you need to keep the grooves to stuck to each other. So that's going to be screw retained.
Okay.
Okay? So the crown and the bottom will come out as a one piece. This is the same thing. Okay? What are these? Oh, that's nice.
Oh, that's prefab.
There's a
Abutment.
pre-
Yeah,
abutment.
Prefabricated.
Direct
Okay.
abutment.
And what about this?
The same thing.
Actually, this is not prefab.
I think this
Lab.
is
That's a custom.
right.
That's a custom.
Yeah.
See how it is
Yeah, it's very
very
nice.
that's right,
done,
yeah.
right? See the margins going up and down, and like a crown prep.
Yeah.
So this is a custom abutment. What is this one?
This is the prefabricated.
Prefab abutment. Okay. So this is you cannot adjust anything except the height.
The occlusion.
A little bit.
Occlusive.
Yes. Okay. This has groove. What's that? Oh, this is yeah. So
Modified.
this is what's this?
ungulated abutment.
Yeah, for
Yes.
ovulation.
So this is prefab angulated abutment, and this is what is this?
This is also the
This is the abutment, the implant replica with the abutment. So this is you get if you take an implant level impression, abutment level impression, you put this as one piece.
Oh.
Make sense? So this is duplication, but this is comes at one piece. That's why this is you cannot adjust at all, right? And I think this is the when you take the impression for it, you put this over it. So okay, so this is how it's gonna be confusing. You have an implant in the patient mouth. You're gonna put the abutment. You're gonna put the cap over it. You're gonna take impression. Okay, this will come in the impression. You're gonna put this there and you pour it.
You pour. Okay. Yeah.
Okay, that's why you cannot adjust at all. Okay,
And sometimes can this be plastic? You remember there is one that is.
it depends on the system. Yes,
uh-huh.
it depends
Okay.
on the system.
Mhm.
You're right. Okay. This is the same thing. This is angled, and this is again a custom abutment. Again, see, you cannot. They tell you the manufacturer you cannot pass the black line.
That's
So you can't-
custom abutment.
So you can't. No, this is
No,
this
that's
is
not
direct
prefab.
abutment.
Prefab.
Prefabricated.
You
cannot touch
can
it.
modify this occlusion to the line. You take the impression. You put. This is the plastic one.
Okay.
You put the cap over it. Take impression. The cap comes inside the abutment. Inside the impression.
Then with the
You put
coffin.
this over it. Okay. And you
So
take
it's gonna go
impression.
inside
Then
the
the patient
mouth.
stays with the original abutment in the mouth already.
It's whatever you prefer.
You can take it out and put it back. And
I
Usually it's already
usually don't
there,
keep the abutments. I usually take it out
Okay.
unless, like put the healing abutment back.
Okay.
And,
And then when
deliver,
everything comes in one piece, you-
Some doctors they torque it already and leave the patient with the abutments, but it depends what the doctor prefer. Okay. So these are the parts.
Doctor, can I ask you something?
Yes.
Because I saw that all the trays, all these have just one replica implant. So does mean when we decide who is gonna show you first, because it has to be the implant
Yes,
replica,
take
has to be one by
yes,
one, right?
Yes,
So
yes,
it's-
yes, yeah. Because you're gonna because the grading sheet it has the healing abutment too, and what else? What's the first two criteria?